Welcome to Raise the Line from Osmosis.org, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the COVID-19 crisis and beyond. In this special episode, we'll be talking to one of the winners of the 2020 Osmosis Raise the Line Faculty Awards. Only 5 were selected out of hundreds of nominations we received. Osmosis's engagement manager, Lindsey Smith, sat down with each of them to ask about their career, their methods, and their advice for future healthcare providers.
Hi, today I'm joined by Dr. Mary Brennan, who won the Raise the Line Faculty Award competition in 2020. Thank you so much for joining us today.
Thank you, Lindsey. It's a pleasure, and thank you so much for the award. It's thrilling.
Absolutely. Well, let's get started. And if you wouldn't mind just giving a brief introduction, who you are, what you do, where you work at.
Yes. Well, my name is Dr. Mary Brennan, and I am the director of the Adult-Gerontology Acute Care Nurse Practitioner Program at New York University, Rory Meyers College of Nursing. And I've been in that position for about 16 years now. And yes, teaching a lot of students, and I love it. Absolutely love it.
That's awesome. Just to get started, I'd be curious to know about your background and what got you started in education.
Mm-hmm. Well, when I was reflecting on this question earlier, I thought, while I was a kid, I loved science, I loved art, and I loved reading. And I think being a teacher sort of encompasses all of those things. But I started out as a nurse, and I worked in an intensive care unit, and I absolutely loved working in critical care. I loved taking care of families. I loved taking care of patients who had critical illnesses. I really liked understanding everything that was going on with the patient. So that was my entree into becoming a nurse practitioner. And once I became a nurse practitioner, I also gravitated towards the acute care setting. And I'm both a primary care nurse practitioner and an acute care nurse practitioner. And I have specialized primarily in cardiovascular diseases. So I worked on a cardiothoracic surgery service for a number of years, and currently I work in a cardiology service. And I think my love of teaching began as a nurse, because I also like to teach other nurses about what I knew. And I think a couple of opportunities came my way, and I was offered the position as the director of the Adult-Gerontology Acute Care Nurse Practitioner Program. It was a stretch for me, but I loved the challenge, and I really loved teaching other nurses how to become nurse practitioners. And I think I had a vision of what a great nurse practitioner would be, somebody who not only took care of patients, but helped to transform healthcare. And I just wanted to see the acute care nurse practitioner role grow so much. So yes, so I love to see how the students develop into this role. And basically, I think how they go out now, and so many of my I hear so many complimentary things about my graduates, and I think my graduates are my best advertisements for the program. So, and we can get into a little bit more of the specifics.
Yeah, absolutely. It sounds like you're a natural born educator from the start.
You know, I don't know that I'm a natural born educator, but I will say that a lot of people have helped me along the way, and there are role models that have definitely been important. And I think of one professor in particular. He was a professor of history, and he taught in our college in the Center of Teaching for Excellence. And I went to those courses, and he basically revolutionized my teaching approach. Prior to that, I used to have a lot of PowerPoint slides, and I used to have a lot of content, and I would give the students a lot of content. And when I went to his classes, he talked about actually stimulating critical thinking and allowing students to solve problems and generate decisions. And he said, students should be talking 80% of the time in class. They should be analyzing, they should be comparing, they should be contrasting. the teacher should be talking 20% of the time. That was kind of revolutionary, and sort of adjusting and adapting to that and allowing the students the freedom to explore, to discover, to communicate with each other, I found fascinating. And I really embraced it, and it's worked out very well.
That's amazing. Your teaching has inspired many health professionals, and they nominated you for this award. Can you speak to who or what inspired you to teach?
Mm-hmm. I think that probably I would say my parents, who love to learn. And they weren't educators, but they always read the paper. We discussed social issues in the home. And I think they were probably instrumental in helping me to become a good teacher. And again, I'm going to say, I don't think I was natural born. I think there's been a lot of hard work, and I've had a lot of help along the way with other faculty members and role models. But I think it started when I was very young.
Absolutely. In order to win this award, you received many nominations and testimonials from students and colleagues.
Yes.
I'm going to read you a quick snapshot to get your reaction, and I'd like to know how you feel.
Mm-hmm.
I nominated Mary Brennan because she reaches further as a passionate and dedicated educator, putting the needs of others before her own. A true innovator, Mary Brennan has led us into the future with Acute Care General Hospital, the virtual learning environment which helped nurses gain confidence and learn compassionate care. I aspire to be just like her in the medical field. How does that make you feel?
That makes me feel that's so lovely, and I feel so proud, and I am so proud of all of my students. It's so nice to be recognized because I can push students. I believe in having high expectations for students, and I like to have students rise to those expectations. And I do know that all of my students work very, very hard. But in the end, I think the hard work matters, and all the students appreciate that they were able to be successful in a course, in a program that was rigorous.
And this might kind of tie into, I'd love to hear a little bit more about the Acute Care General Hospital. With COVID, it's brought unique challenges to everyone.
Yeah.
What has your experience been like? What have you learned, and how have you overcome some of these challenges?
Well, I think in the beginning of the pandemic, when we were quarantined, a number of my students were nurses in acute care settings. They actually had to go into work and work with patients who were critically ill and those who were on ventilators with COVID-19. And it was even in the very beginning of the pandemic when we didn't have a lot of guidelines. And I think that was very, very tough for my students. So I had to be very compassionate, and I had to understand that maybe they weren't going to be able to do the curriculum as we had planned. And I had to adjust my expectations for them. And I think, they were absolutely amazing, going in and taking care of patients at their own risk. A number of them contracted COVID, and it was before there was even a recommendation to wear masks with patients. So I think, it taught me a lot, and I think the students helped me to learn about having compassion during that time.
That's great. I think everyone had to have a little bit of flexibility, especially in the early stages, for everyone that's been on the front line, and absolute heroes for what they're doing.
Absolutely. And so many of them rushed in to take care of those patients, knowing that this was a very infectious disease and potentially fatal. So to actually to do that, I think was just wonderful. And I think the public also has recognized how impactful nursing care has been. And I think that's been so nice too, to see the public recognize and appreciate the role that nurses have played.
Absolutely. Yeah, we're seeing that all over, which is amazing. Well deserved.
It is, yes.
What is next for you and for your institution?
Mm-hmm. I think that, and maybe this was enhanced or accentuated not only with the pandemic, but I think the Black Lives Matter movement. I think that we all understand the imperative to dismantle structural racism. And I think that our institution concentrates on mitigating and eliminating health disparities. That's one of our frameworks. And I think that we all understand as a collective that that is our next goal, our next imperative. So I know that's important for all the different faculty, and that sort of the classroom is a microcosm of society, and we cannot be separate from what's going on in society. And so we have to have the difficult conversations, and we have to absolutely help our students to understand how structural racism has contributed to health inequities rather, and that we must promote health equity for all.
Absolutely. That's wonderful that you guys are taking such a strong stance on that.
Yes.
So we at Osmosis are a teaching company. We love to fill in knowledge gaps. If there's any topic that you'd like to educate us on that you think everyone ought to know about.
I looked through all of the videos that you offer, and I think they're all great. They're creative, and I think they're fun, and I do think they would help students learn difficult concepts. I think what I'd like to see is that everyone understands that we are accelerating in our view of teaching as well. The teaching isn't necessarily transmission of facts, but it's really helping students with critical thinking, I think critical reading. We help the students to develop a diagnosis or a differential diagnosis, and to develop the best treatment approaches. So I think some of the new and novel ways of educating students might be helpful to educators in the group. And as healthcare professionals, we're all educators, because we do need to educate our patients and their families.
What advice would you give new students entering the medical field today?
Mm-hmm. I think that students are so capable of doing so much more than sometimes teachers and educators expect of them, that I really have shifted away from passive learning approaches where the teacher has to give the facts and the students memorize, and that keeps the students dependent upon the faculty. What I like is to inspire students to become the very best that they can be. So to help them along the way develop their critical reading and decision making so that they can be the very best. So I kind of like that idea of helping students to become independent learners. And I think as nursing professionals, that's something that's very important. You are going to have to be an assertive, independent learner to keep up with all the research that is generated every year.
Yeah, it's constantly changing. So lots of new information to keep up on for sure.
Absolutely. And then secondly, I was talking to a former student today, and she was saying and we were commenting on how really understanding why things happen, particularly in science, understanding a concept and why that concept I think is so important. So really having curiosity, delving deeply into a subject matter is very helpful. Very good habit of the mind to cultivate.
Anybody that you would like to thank, peers, students, or any departments, colleagues, parents, anyone?
Well, I would like to thank all of my former students, every single one. Some of the ones who love the program, and maybe some of the ones who didn't love the program so much, because I know they all worked very hard. And I personally believe that you cannot be an acute care nurse practitioner without putting a lot of effort and time into your craft. You have to develop your craft. So I know many thought, it was a lot of work, but I think in the end, they appreciated that they did learn as much as they did. I have to thank everybody at NYU and all the faculty primarily who've helped me to learn so much. I would not be here if it weren't for all of them. I've learned everything from them. And I actually even started as a faculty member before I went to school for my doctorate. And I thought my doctorate was sort of much easier to do, having been in academia for 10 years. I knew a lot of the material. So it definitely gave me a leg up. And I also saw that Ruth Kleinpel was a recipient of one of the faculty awards. She's a nurse practitioner. She's actually an adult acute care nurse practitioner. I admire her. She's such a role model in the nurse practitioner profession. And so when I saw her name on the list of recipients, I felt so proud too.
Well, that's amazing. And thank you for all of your wonderful work in education. Your students are definitely lucky to have you in their corner, kind of cheering them on. And it is very clear by the number of nominations that you received that you're definitely making a big impact on their lives. So thank you for all that you do. And congratulations again on winning the Osmosis Raise the Line Faculty Award.
Well, thank you so much, Lindsey. It was a pleasure. And thank you again for this great honor. It was very unexpected.
For more information on how you can help raise the line and flatten the curve, go to osmosis.org/COVID-19. If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our podcasts at osmosis.org/Raise the Line Podcast.